A case I want to share with you of a mommy makeover. This beautiful 48-year-old patient came to me after losing a lot of weight. She cannot lose any more weight and she cannot get her belly flat. She also suffered from big, droopy, heavy breasts. She wanted to consult with me. How could she improve her body and breast appearance? We discussed what she doesn't like and how she wants to solve, and we came up for a solution. The solution was to perform a breast reduction and address also what we call the lateral chest, excess skin or the side boob, perform liposuction of her trunk, what we call a 360 liposuction that reduces the overall thickness of the skin, and finish it with a abdominoplasty or a tummy tuck that will help us making the belly flat and take care of the excess skin. And this is how she looks after. Starting with the breasts, the scars are around the areola, vertical scars and scars that go under the fold. Because she had a lot of excess skin on the side, we had to continue the scar a little bit to the side, but you can see it's nice and flat over here. Not a lot of bulges like she had before over here. And a tummy tuck. You see that the scar goes really, really low. Not really visual if you just put an underwear. It can be covered, even a bikini. The belly button, usually I locate it between a third to half distance between the pubic bone over here, the crest, and the solar plexus. So it's kind of like a third of the way. There's a special technique that makes this belly button looks more inny than outy. It doesn't look like a cat's behind. And I want to show you another thing. Here's her side picture. You can see how her belly is protruding here. Very uncomfortable, especially putting in clothes. They need to a lot of times work with garments or corsets. And after the procedure, belly's almost flat. Natural curve of a youthful abdomen. The breasts are perky with the nipple looking forward, and the scars are almost unnoticeable. That's our case for today.